Employees who add their spouse and/or dependents to any medical, dental, or vision plans must provide verification documents to prove their relationship. As a reminder, if your spouse is eligible for health insurance coverage through their employer, they are not eligible to be on the Iredell County Health Insurance Plan. Failure to comply with the eligibility of the spousal policy may result in disciplinary action up to and including termination, as well as reimbursement to the county for all paid claims on the spouse who should have been removed from the plan. If you should need proof of coverage so your spouse can enroll in their own employer's health insurance plan, please contact Human Resources. The rates are as follows for high deductible and open access plans for 24 pay periods. Rates are tentative, and official rates will be communicated after budget approval. The fee of $30 per pay period is per individual on the health insurance plan not participating in the wellness program requirements. More details will be explained in the wellness program videos later on. If you are or plan to enroll in the high deductible plan, here are some points to keep in mind regarding your HSA. Because the HSA has special tax advantages, the IRS has specific guidelines in place that must be followed. You must be enrolled in a high-deductible medical plan, or not covered through Medicare Part A or Part B, or not covered by spouse's medical or pharmacy plan, or cannot be claimed as a dependent on another person's tax return, or not covered under a general purpose flexible spending account, FSA, either employers or spouses. The IRS sets limitations on your annual HSA contribution amount. For 2016, up to $3,350 for individual coverage and up to $6,650 for family coverage. Age 55 or older, maximum contribution increase by $1,000. Any contributions to your HSA that you receive from your employer count toward your maximum contribution. On the Open Access PPO plan, there is a $150 deductible per member with a maximum of $300 per family for all medications. This deductible will apply to expenses from July 1, 2016 to June 30, 2017. Once you have met the deductible, your prescription drugs will be covered with the following copays. Your pharmacy coverage will be with CVS Caremark. Your pharmacy PCN and BIN numbers should be imprinted on the back of your Cigna ID cards. On both plans, specialty medications, which are those very expensive drugs used to treat chronic conditions, will require authorization and will be dispensed in 30-day supplies. Your first fill can be filled at a pharmacy of your choice. Please call Rx Benefits Customer Service to make arrangements at 800-334-8134. Additional fills should be through the Caremark Specialty Pharmacy. On both plans, you have the option of filling your maintenance medications in a 90-day supply through either Caremark mail order or a retail CVS store in your area. If you are on the OAP PPO plan, this will save you in copays after the $150-$300 deductible has been met. On the high deductible plan, you will receive the benefit of a lower total cost and have a larger quantity on hand. Generic drugs are typically less costly than others. You can save money by using generics when possible. By registering on Caremark.com, you can see what generics are available. Discuss this with your physician or pharmacist to determine what might work best for you. On the high deductible plan, you are responsible for the first $2,000 in pharmacy and medical expenses. Cigna and CVS Caremark will be sharing information to track what you have used on each plan. Once you have met that deductible, you will only owe 30% of your pharmacy charges until you reach the out-of-pocket maximum on your plan in combined pharmacy and medical charges. It is important to note, even though you are responsible for 100% of the cost, we want to make sure you get the full advantage of the negotiated discounts. So please make sure your pharmacy is processing these charges through their system so you will get the discount, and these charges will apply to your deductible and out-of-pocket maximum. If you have questions, please contact Rx Benefits Customer Service at 800-334-8134, Monday through Friday, 7 a.m. to 6 p.m. Central Standard Time.